Falling is one of the greatest fears for any resident living in assisted living. This fear is shared by the resident, their family, and of course the staff members working in the facility. As a caregiver, it is our responsibility to do everything we can to help prevent falls by our residents. According to the Centers for Disease Control and Prevention, more than 1/3 of adults aged 65 years and older fall each year, making falls the leading cause of injury-related deaths and the most common cause of non-fatal injuries and hospital admissions for trauma among older adults. In 2001, more than 1.6 million seniors were treated in emergency departments for fall-related injuries, and nearly 388,000 were hospitalized. The consequences of a fall in older adults can be both varied and severe. Of those who fall, 20 to 30% suffer from moderate to severe injuries such as hip fractures or head traumas that reduce mobility and independence. Additionally, they suffer from increased risk of premature death. The physical consequences of falls can include fractures, head trauma, and possibly death. The most common fractures are of the vertebrae, hip, forearm, leg, ankle, pelvis, upper arm, and hand. In 2001, more than 11,600 people aged 65 and older died from fall-related injuries, according to the CDC. We should also consider that the consequences can go beyond the physical. There are also psychological effects related to a fall, one of which is fear. If we listen to older adults talk, they often talk about friends or acquaintances or perhaps fellow residents within the assisted living facility who have suffered falls. They talk about the consequences they have seen, the hip fractures, the walkers, the wheelchairs, the surgeries, and even the deaths. This fear of falling can actually cause a person to become increasingly dependent on others for care. This is particularly true if a resident has suffered a fall himself. If that individual has gone through a fall, particularly a fall with injury, they may end up living the rest of their life afraid of having another fall. This can cause them to become unnecessarily dependent on walkers, wheelchairs, or caregivers for assistance to transfer and ambulate. And of course, as that person becomes increasingly dependent, their general physical and psychological health will often deteriorate. It is no exaggeration to say that a fall in an older adult can be the beginning of a downward spiral. This stresses the importance for us as caregivers to take all the necessary steps in our facility to protect our residents from falls. During this video, we will discuss how to identify fall risk factors in your residence, steps that you can take to prevent falls and fall-related injuries, and how to appropriately respond to falls, what to do if a resident falls in your facility. With this information, you will be empowered to protect the safety of your residents. When managing falls in an assisted living facility, one of the first things we want to do is identify those factors that put a person at an increased risk for falling. The following risk factors were identified in a fall risk assessment tool from the Hartford Institute of Geriatric Nursing. Many of these factors could be identified as resident risk factors. The first of which is age, specifically being over the age of 65. As a person gets older, they are inherently at an increased risk for falling, as the following risk factors become more common. Second is a history of falls. If a person has fallen in the past, and the underlying factors that caused that fall have not been corrected, then they are of course at an increased risk for falling when compared to the general resident population. There are also a number of factors that could be related to dementia or other cognitive impairments. These would include confusion, increased anxiety, impaired judgment, and uncooperative or resistive behaviors. Next is being ambulatory dependent. If the person requires assistance from a cane, a walker, a wheelchair, or a caregiver to ambulate and or transfer, then they are at an increased risk for falling should that assistance not be provided in a timely manner or should it not be utilized appropriately. For example, if a resident requires the assistance of a walker to ambulate, but while in their room they choose to leave that walker sitting by their door and not use it, they are of course at an increased risk for falling when doing that. Sensory deficits. If the person has visual or hearing impairments, they are more likely to fall. Visual impairments could prevent them from appropriately seeing the environment. They may, for example, not see a rug on the floor and trip over it. And hearing impairments could cause them to not hear instructions appropriately. For example, if a caregiver asks the resident to wait one moment before getting up, and they will come help them, but the resident does not hear that and tries to get up on their own. Incontinence. Particularly if it's an urge incontinence, in which the person has a sudden need to go to the bathroom. This may cause a person again to get up and attempt to ambulate on their own when they are not able to do so. Cardiovascular or respiratory diseases also place a person at increased risk for falling. This could be due to a shortness of breath, an increased fatigue, as well as some of the medications that person is likely to be taking. Finally, if the resident suffers from a condition known as postural hypotension. Postural hypotension means that the person has a sudden drop in blood pressure when they stand up. When this happens, the person could become dizzy, become lightheaded, and possibly lose their balance and fall. If you believe a resident has postural hypotension, you want to speak with their physician, as it's quite possible an adjustment in their medications could help to correct this problem. We also want to encourage residents with postural hypotension to stand slowly and sit at the edge of their bed or chair for a few minutes before they stand up. In addition to these resident factors, the Hartford Institute also identified environmental factors in their fall risk assessment. Two of these environmental factors included being new to the facility, most specifically when a person is in their first week of residence in your facility. During this first week, they're not as familiar with their surroundings, they're not as familiar with their caregivers, and depending on their cognitive status, they may become more confused. Additionally, if the resident utilizes any attached equipment. In an assisted living facility, the best example of this would be oxygen tubing. Later on in the video, we will discuss in more detail environmental modifications that can be made to help protect your residents from falls. Identification of these and other risk factors in your residence and in your facility can be your first line of defense against falls. Should you identify these risk factors, you want to talk to the resident's physician and your supervisor to strategize the best interventions to minimize this individual's risk for falling. The first step in fall prevention is assessment and appraisal. There are 4 basic components to a good fall prevention assessment, which of course should be conducted by an appropriately trained and, if necessary, licensed individual. Refer to your facility policies to clarify who performs assessments and appraisals in your facility. The first assessment is pre-admission. Before that resident moves into the facility, we want to identify any severe fall risk factors that could be corrected. Secondly, identify and treat any underlying medical conditions. Medication assessment. If the person is taking multiple medications at the same time, the combined effect of those medications can increase the risk for falling by creating dizziness, unsteadiness, or unstable gait. Finally is assessment after falling. Should a resident fall in your facility despite your efforts to prevent it, an assessment and appraisal should be performed to identify what caused that fall. Why did the resident fall, and what could we do to prevent it in the future? The next step in preventing falls in your facility is to establish a safe environment. Let's look at some of the key features of the common areas and hallways within your facility. First would be lighting. We want to ensure, of course, that lighting is adequate in common areas and hallways at all times, including at night. Provide sufficient overhead lighting that doesn't require a lot of effort on the part of the resident to turn on. Most preferable would be lighting that stays on at all times. If the decision is made to use night lights in hallways at night, be sure they are adequate to sufficiently illuminate the resident's path. Next is flooring. Now, of course, it's not always possible or easy to change the flooring within a facility, but as much as we can, we want to give some thought to a good, safe, non-slip floor. We also want to avoid thick carpets or rugs that could cause the person to trip. As a general rule of thumb, throw rugs should be avoided altogether. It is very easy as a resident is walking down a hallway for their feet to get caught on a throw rug and cause them to fall. This is particularly true of persons with Parkinson's disease who may develop that notorious shuffling gait in which their feet barely pick up off the surface of the floor as they scoot down the hall. Watch for and remove obstructions. This could include furniture that is left in a hallway, such as a sitting chair in a long hallway, medication carts, or laundry carts. Be sure these are not left in the hallway where they could get in the resident's way and cause them to fall. You also, in that regard, want to look at the resident's room. If they bring excessive amounts of furniture or large pieces of furniture when they move in, it may cause them to have very narrow pathways in their room, which are difficult to safely navigate. We also want to look at the general design and layout of our hallways and common areas. If residents have to walk long distances to get from their room to a dining room or to an activity room, are there places where they can stop and rest? Are there seats or benches which are appropriately placed throughout the facility? Whenever possible, handrails in a hallway can be very beneficial for your residents. Ensure appropriate fire clearance by speaking with your fire marshal before placing any furniture in common hallways. If these create an obstruction, they can be a violation of your fire code. We want to pay special attention to the bathroom. Some things to look for include, again, lighting. Ensure that there is adequate lighting in the bathroom at all times. The distance to the bathroom. If we have a resident who is at particular risk for falling, we may want to put them in a room that is closest to the common bathroom, so they're not having to walk long distances to reach it. Non-slip mats and rugs. The use of a shower mat or bath mat can be very helpful, as of course the typical tile bathroom floor becomes very slippery and dangerous when wet. But be sure that these shower mats or bath mats are non-slip, so that when a resident stands on it, it could not slip out from under their feet. We also want to make sure we have appropriate grab bars in our bathrooms. Now, this is often an item that is specified in your fire code, but at a minimum, we want to ensure that there are grab bars near the toilet, in the tub and shower, and anywhere that the resident might need some assistance while standing. Another environmental feature to look for in your facility is the use of call lights or emergency call systems. If we have a resident who is transfer or ambulatory dependent and they need help at night, how do they summon staff? Do they use a call light, a touchpad, a telephone alarm? Make sure there is some system in place that allows them to call for help without having to get up on their own should it be unsafe. We also want to make sure that we check those call systems to ensure that they're functioning on a periodic basis, and also to test our staff. It's a good idea for a manager or department head to randomly push call buttons on a daily basis to ensure staff are responding within an appropriate amount of time. According to the CDC, environmental modifications alone are not enough to prevent falls in older adults. 3 other areas that should be addressed include lower body strength, gait and balance, and medication use. Lower body strength, gait, and balance can be improved and maintained through regular exercise. Now, of course, we want to speak with the resident's physician before engaging residents in any type of exercise program to ensure that they can safely handle regular physical activity. One very effective exercise program in older adults is Tai Chi. CDC research has shown that Tai Chi helps to improve lower body strength, gait, and balance, thereby reducing the person's risk for falls. We also want to take a close look at medications. According to the CDC, if a resident takes 4 or more medications per day, or if they take any psychoactive or psychotropic medication, they are at increased risk for falls. Regular physician or pharmacy review of your resident's medications can help to minimize any unnecessary meds and help to avoid potential drug interactions that